At IREC we've seen quite a few tick cases already this year. Generally we wouldn't think that we would have tick patients still essentially in the middle of winter. However, recently we've had quite a bit of rain and some unseasonably warm days, so that's been great for tick breeding, and we've definitely had quite a few patients. Ticks are found right throughout the lower Hunter area. They are found right down the east coast of Australia along essentially a 20 kilometre width band, so most suburbs you'll find your pets are able to pick up paralysis ticks. They do tend to be found generally in bushland. The primary host for the paralysis tick is a bandicoot, but we have heard of ticks blowing down from trees, or they can be collected in grass if your pet's just out for a walk, but you don't necessarily have to be out playing in the bush for your dog or cat to pick up a tick. There are several ticks that we do see in the Hunter region. Here are some pictures of them. So this is the paralysis tick. It's a nice big silver and grey one. The cattle tick and the bush tick are more brown in colour. Though the paralysis tick, when it's quite small and unfed, is fairly brown rather than grey. But you will see, if you look at the pictures, the paralysis tick has all of its legs around the head region, whereas the other two ticks, the legs are distributed more evenly around the body. Paralysis ticks vary quite a lot in size depending on how long they've been attached to your pet and how long they've been feeding. When they first attach, they're often only about 1 millimetre, and as they feed they can grow to be over 1 centimetre. Symptoms of tick paralysis are caused when the tick toxin affects the dog's ability to control its motor function, so it interferes with nerve signals. So we see things like weakness in the hind legs, reluctance or inability to get up and walk. We see vomiting, retching, changes to their bark or their meow, and then we start to see respiratory difficulties because the animals are not able to use their muscles to breathe normally. Paralysis ticks can be found anywhere on your pet's body, although more than 80% of them will actually be found forward of the front legs, so often around the neck and head. But it is important that you check your pet thoroughly and regularly, particularly during warmer weather, for ticks. So I usually just take both hands and then sort of scratch and feel all the way through the fur and work my way from the nose and all the way back to the tail. And then you usually feel just a little lump, and you'll feel that it'll be a little bit mobile, and then you can part the hair and have a look and just check if that looks like a tick. So if you find what you think might be a tick, if you're not sure, you can always phone your local vet clinic or pop your pet down to have someone take a look, or you can remove the tick at home, and it is better to remove the tick sooner rather than later. Don't worry too much about whether you're going to leave the head in there or about getting it out intact. Just if you can just kill the ticks, wash it or pull it out as best you can, and then take your pet down to your vet to have it assessed.